Okay, so now let me get to drug development. So our database, the same database that we used for probability of success calculations, actually had information not only on the particular drugs, but on the trials themselves, characteristics of both. So we're actually able to merge them. So here's an example of the data that we have on 100,000 drug indication pairs. So this is a drug, carperitide. It's for dealing with myocardial infarction, heart attacks. It was launched successfully, but the route of administration, it's an injectable. We don't have any information about the medium. In some other cases, we know that it was a tablet or it's a solution. And this is the pharmacological target. So we've got a lot of information now about the drug and the particular indication it's supposed to treat. And so our objective is to ask the question, for these drug indication pairs, can we predict when it's going to graduate from phase 1 to phase 2, phase 2 to phase 3, and so on. Now, we also have information about the companies themselves, and what we want to do is to merge this information and then be able to use the machine learning algorithms to try to predict. So the information that we're using is the drug features as well as the trial features. These are the right-hand side variables, or the 21 characteristics, like in the case of k-means. And this gives you a little bit of a feel for one of the biggest problems with the data, which is that it's got lots of missing observations. So let me show you exactly what this picture represents. So each column is a different variable or characteristic or feature. And color-coded is the status. So in the first case, the development status, either the drug failed or it got approved. This is the route of administration here. And where you see a red line across it is where the data is missing. So the route of administration, we mostly have that data. But for something like the medium, in many cases, you see the red is missing. We don't have information about the medium. We don't know that aspect of it. So when you deal with these kinds of data, the one thing you have to deal with is all of these missing observations. How do you fill them in or not? And this is trial features. You can see there's lots of missing trial features. So typically, what the studies do in the literature that study these characteristics, what they do is, in the case where there's missing, so each column represents a different feature, a different variable. You've got these little missing categories. When they have missing data, they'll just delete the observation. They'll just throw it out. The problem is, if you do that, you start with 100,000 observations. If you throw out all of the observations with missing data, you're down to like 10 drugs, because you're going to miss some of these features. So what we decided to do was, instead of throwing out the observations, we treat these missing observations as parameters, and we estimate them. We impute them. And there's a very well-known statistical technique for being able to do that. It's not perfect, and we check the stability and the accuracy of these imputations. And they work reasonably well under certain assumptions. But again, it's not perfect. But it allows us to estimate models for a much, much larger set of data. And you don't have to understand this. This is the process that we follow. And the paper is also under review. But once we publish it, we'll be happy to circulate it. But this is sort of standard machine learning kind of applications of estimating and training the model and checking it. And this is what we get. So I have to explain to you, first of all, what you're looking at. So the way that we gauge whether or not we're successful or unsuccessful in a prediction is something called the AUC, which stands for area under the curve. This is a number between 0.5 and 1 that measures how accurate your predictions are. 0.5 means it's random. It's a flip of a coin. So your predictions suck. You may as well just flip a fair coin. If it's 1, it means you're perfect. You will get it right every single time. So the farther you are away from 0.5, the happier you are, the better you do. And so you can see that across all of the indications, we're getting 0.737, which is actually pretty respectable. We can boost that in a variety of ways that I'll describe in a minute. But for now, that's the overall ability for us to correctly predict transitions from phase 2 to phase 3, This is phase 2 to approval, it's 0.777, and phase 3 to approval, 0.81. So we can actually predict reasonably well using these kind of machine learning scores. But of course, it varies across indications. So let me go back to phase 2 to phase 3. So for cancer, it's 0.745. But if you go down to something like cardiovascular, it's 0.67, not doing quite as well. Although these numbers are relatively close. But let me show you phase 3 to approval. Here, all of these numbers are above 0.7. So when you get to phase 3, there is still risk. You saw the probability of success from phase 3 to approval is nowhere near as high, but we can actually predict what it's likely to be with reasonable accuracy. And I won't take you through this, but I want to just show you the bottom line, which is that if you look at what variables matter, what are the features that come up most often that are being selected, it's the trial outcome. Have you met your endpoints? That's obvious. Trial status, is it completed or terminated? Prior approval of the drug for another indication, that's huge, not surprisingly. If the drug has been approved for something else, first of all, you already know it's safe, right? And so that's a huge leg up. And finally, sponsor track record. So in other words, if you've approved other drugs in the past, most likely you're going to actually be able to get this drug approved. So these variables, as you would expect, do play a pretty big role. And finally, I'll show you, to conclude, these are our estimates of the successes that are yet to come. So our data stopped in 2015, so we thought for fun, let's just take a look at what the most likely winners are. We have no idea whether any of these are good or bad, but in case any of you know what these drugs are, you can see that from our perspective, they're actually very likely to succeed. So that's this project. We think that there's a lot of opportunity here to be able to take this and implement it more broadly. If investors feel that they can actually predict success or failure, they might actually provide more funding to these kind of projects. Reduces the risk, increases the opportunity.